Hello and welcome. Today we explore a real-world case of ACSM. So this is turning TB around. The information was verified through key informant interview of the TB program officer of CAR, who happens to be my husband. I knew about his work, but I wasn't able to articulate it as ACSM in action until this course. So this presentation was enlightening for me as I got to know a real case more deeply on a personal level. So what is ACSM? Let's recall. It stands for the three interconnected strategies, where advocacy is about influencing decision makers or getting leaders to commit. Communication targets individuals to shift knowledge and behavior, and social mobilization brings entire communities together to demand and support health services. So together, they try to create change at every level. Let's look at the TB challenge in the Philippines. The Philippines has been consistently among the top 5 TB burden countries, and 6.8% of all TB cases all over the world is in the Philippines. And 581 out of 100,000 Filipinos have TB. And this is where we see how ACSM can enter. I primarily see it as a communication, collaboration, and mobilization gap. Because from the 2016 National TB Prevalence Survey, 41% of symptomatic individuals took no action and 40% self-medicated. And when they get treated, 42.4% of affected households spend more than 20% of their annual income just for the 6-month treatment. So who is PBSP, the main actor for the ACSM? They are a private sector NGO that serves as the Global Fund's principal recipient for TB in the Philippines. And they have a particular program, which is Access TB. And what Access TB primarily rolls out mobile X-ray van clinics and contributes to active case finding. So much like contact tracing during the COVID times. Their goal is to reduce TB deaths and to reduce the families facing the catastrophic costs and reach 90% patient satisfaction for TB services. So these TB services are already being given by our DOH National Tuberculosis Program. So their role is not, of course, to replace the DOH, but to give ground support and provide a better ACSM strategy. So in their manual of procedures, it specifically points out there how the ACSM framework is used. So let's take a look at them one by one. First is advocacy. So they had a program before, beyond 2022, and they were able to get around 200 participants all over the Philippines. And they use this avenue to secure institutional buy-in and to remobilize political commitment after the COVID-19 disruption. Because this would be a textbook external perturbation response, in one of our modules, it's called punctuated equilibrium. And during that time, a WHO representative noted the decline in TB case notifications. And when TB case notifications decline, there might be patients who have gone untreated. So an example of the turnover of a mobile van clinic to LGU Baguio. Second is communication. So they have an active electronic e-learning platform, and the primary targets would be barangay health workers or BHW. The training aims to train the BHWs to adopt behavior change communication and to do interpersonal counseling and to improve patient enrollment for treatment. So by doing this, by training the communicators, the TB stigma is stripped. So this is another training session on near point of care machines. So TB is diagnosed primarily by sputum samples, and therefore they get to do it immediately as soon as the sample is received. Another one would be the DOH campaign, which deliberately reframes TB screening as a routine lung health maintenance. And that way, again, it strips the stigma trigger because of TB-specific language. And the NGO supports this implementation of this kind of messaging across its network. Third is social mobilization. They have what you call striders. These are motorcycle riders who transport sputum specimens from rural health units to gene expert laboratories. They also are able to get the sample from the patients themselves without the patient needing to go to the main laboratory. There are community volunteers. These are the on-the-ground personnel for active case finding. They also have a program where they message or call the patients for medication reminders and follow-ups. So this removes the structural barrier of that no communication campaign can solve. Third is the TB mobile van clinics. So they provide free x-rays, specimen collection, and primary care delivered directly to hard-to-reach municipalities. So one of the target populations would be the persons deprived of liberty. And because of the closed environment in those places, it is possible that TB can be more communicable in those places. As for CAR, because our region is mountainous, it's very difficult to reach far-flung barangays, and therefore this smoothens the process. And the result, of course, is increased screening. So they do TB caravan every now and then, so that presumptive cases can already be assessed on site. So what are the results? So these are the accomplishments for the fiscal year 2025 to 2026, wherein more than 500,000 individuals with TB were notified, or these are called what we call the TB notification cases. And there had been preventive therapies, okay, not just to the patient, but to their family and close contacts. Among those are those people, PDLs, more than 7,000 of them. And 66,000 were also among the vulnerable populations, including the senior and the young. So moreover, all these data were presented during the World TB Day in 2025. So there had been more than 7,000 individuals with multi-drug resistant tuberculosis and initiated antiretroviral therapy with persons with HIV. So HIV is known as a comorbidity of TB. And among the individuals with all kinds of TB forms, they had seen a treatment success rate of 87.05%. And in their social mobilization, they have deployed almost 400 striders, 700 access TB GeneX machines. So these are the machines to test the sputum sample, and they get to know whether it is TB or not. So nationwide, we have 27 operational TB culture centers. So they won't be relying on the main office in Manila. We also have 119 active IDATS coordinating centers. These are the centers where the patient can get their free medication. And they have engaged over 400 community volunteers. Despite all this, there are still documented gaps. For one, we have the Samahan ng Lusog Baga, SLB, Lusog Baga, the TB Survivors Organization, which sits on the technical working group as well as the Global Fund working group, but reports limited meaningful engagement. This means that there is insufficient advocacy capacity to influence decision. You see, ASCM should focuses on reaching people with information and services, but fails to empower them, would be incomplete. And this is admitted by WHO's definition in their reports. Second is the ACM quality varies widely across provinces and municipalities. So of course, we have to put into context the the actual situation and the reception of ACSM strategies in the different provinces. Most organized community support for TB control exists only where external funding is present. So apparently they're only active if the funding is there, and they lose their momentum when there is no funding. And lastly, that the LGU absorption of ACM activities after the grant cycles remain an open questions. So unless they have a definite program on how to sustain these efforts, then it would be again just dependent on whether there is a grant giving body. So for my reflection, uh, Access TB project is a case that demonstrates what ACSM looks like when it is well resourced and professionally managed. It means that they support our DOH NTP initiatives. So the support is on mobilization activities, equipment procurement, so for the gene expert devices and mobile vans, as well as technical support. So they also provide training to our DOH personnel. Second is because ACSM calls for empowerment more than communication, it needs to strengthen the networks that were created and community structures that they have to keep working long after the initial campaign concludes. So thank you very much for your time. These are the references which will be posted in the discussion.